antipsychotic-induced weight gain. Hello everyone, this is the evening session and I'll be talking about the role antipsychotics have to play in terms of weight gain, known mechanisms and interventions regarding treatment. My presentation's title is self-explanatory. Antipsychotic-induced weight gain mechanisms are not definite, so we will be talking about possible mechanisms, not well-established mechanisms. According to FDA, in order to call it antipsychotic-induced weight gain, there needs to be a 7% more weight gain after the patient is put on antipsychotics. If the patient is 70 kgs at the beginning of the treatment, and if after a while if it's 75%, then it can be said that it's induced by antipsychotics. The most blamed agents are clozapine and ziprasidone, quetiapine, and risperidone are also blamed to a lesser extent. And ziprasidone, amisulpride, and aripiprazole are not really blamed because of this. And some patients lose weight because of these agents. But of course, this varies based on different clinical factors. Many clinical parameters can trigger weight gain in patients. Dosage of the medication, duration of treatment, period of illness, age, gender, environmental factors can all trigger weight gain. Also, studies reveal certain interesting results, but the clinical factors reveal that first episode patients have a high likelihood. Non-Caucasian ethnicities also have more weight gain problems. In terms of gender, we don't have any known parameters. Young age also is at a high risk in terms of weight gain. Now, this graph shows us antipsychotics and association with clinical factors. I believe this is quite significant. 1 year weight gain in patients treated with antipsychotics is shown here. Olanzapine and clozapine is well known. Weight gain is quite high. In quetiapine and risperidone, it's low, but still there's weight gain. Aripiprazole, based on body mass index, there's a variation. If the body mass index is lower than 23, and if it's between 23 to 27, aripiprazole causes slight weight gain. But if the body mass index is more than 27, then there's weight loss, not weight gain. And as I said previously, there are so many clinical parameters that have an impact on the weight gain patterns of the patient. Ziprazole also at different doses have different ramifications regarding weight gain. Antipsychotics increase calorie intake as a rule of thumb, and they suppress the metabolism and decrease fat oxidation and increase carbohydrate oxidation. Antipsychotics had an impact on the dopaminergic system. This is what we had in the past, and the side effects were extrapyramidal syndromes. But now we have 8 typical antipsychotics, and these work on different sorts of receptors, and that's why we have metabolic syndromes, these side effects, and we have weight gain. Atypical antipsychotics work on many different receptors. That's why they cause weight gain. It is said the most important systems are histaminic systems and serotonergic systems. The studies conducted show that H1 histamine receptor antagonism increases feeding in rodents, and also Psychotropics with greater ability to block H1 receptors often show greater weight gain potential, possibly through deactivating brain satiety centers. And as I said, this is also demonstrated in rodents. The second important system is serotonergic system. 5-HT2C receptor gene comes to the foreground here. Clozapine and olanzapine, they have this feature, and this is why they cause weight gain, it is said. Aripiprazole, because of the 1A agonism, is less associated with weight gain. 5-HT2C receptor, if we can detect polymorphisms of this receptor, we will be able to prevent weight gain of these patients, according to certain studies. As for the dopaminergic system, we know less about this system. Dopamine antagonism decreases physical activity, thereby creating or causing weight gain. Adrenergic system, again, this has an impact on the, this converts fat into energy, and this has an impact on obesity, or triggers obesity. And antipsychotics that have this feature can thus cause weight gain. As for clozapine, cytokines are on the rise in schizophrenia patients that are gaining weight. Inflammatory processes may have a role to play, it is suggested by certain studies. Cholinergic system in antidepressants, there are different side effects, especially muscarinic receptors 3 and 3, and weight gain is demonstrated to be associated. Atypical antipsychotics are metabolized through cytochrome enzymes, and in schizophrenia patients, if there is a genetic polymorphism, then there are problems and certain side effects emerge, especially CYP-D2D polymorphism is associated with olanzapine and risperidone-related weight gain. There are many hormones that are blamed for weight gain: insulin, leptin association, and ghrelin in schizophrenia patients is elevated, and the other professors will talk about details, so I will just skip this for the time being. All of these mechanisms have impact on the central level, and they have an impact on the satiety center of the brain and cause weight gain. There are certain peripheric proteins that have been looked into. Insulin release related membrane proteins have been subject to certain studies. We know at the moment that SNAP25 is such a protein. Polymorphism in this protein could release insulin release and have a negative impact on the natural mechanism. Of course, many schizophrenia patients have comorbidities, and there's polypharmacology, and these may have an impact on the results, and that's why when we interpret the results we need to be very careful, and that's why we need to take these components into consideration when we devise our studies. So these are the general mechanisms. As for treatment, what can be done will be the next part of my presentation. First of all, the patients, when we put patients on antipsychotics, we need to train them well, the patients and the patients' families, in order to achieve more compliance. They need to be told about the importance of a good diet and the importance of working out and increasing their metabolism. We need to also get consent from the patients. When we regulate the medication regimen for the patient, we need to take a look at BMI, waist, glucose, and other blood tests must be run. And we need to use an algorithm to keep an eye on these over time, and when there's an anomaly, we need to intervene. If there's an unwanted side effect or weight gain, first of all, we could switch to another antipsychotic with a less or lower weight gain possibility. If the patient is in a polypharmacy situation, then we can perhaps discontinue some of the medications, but of course we need to make sure that the patient's stability is not impeded. If despite all these measures, if the patient still continues to gain weight, then anorectic agents or appetite suppressants might be used. There are so many agents that are available, but we need to go for the ones that whose effects have been well demonstrated. One of these is metformin. As you know, it's an anti-diabetic agent, and in schizophrenia patients, it has an effect on weight gain, and in terms of side effects, it has a good tolerability profile. Sibutramine is a mixed serotonergic and noradrenergic reuptake inhibitor, and it helps patients achieve a 10 to 15% loss of body weight, but we need to keep an eye on cholesterol and LDL levels. And if the patient is using antidepressants in terms of serotonergic syndromes, we need to be on the lookout. Orlistat is a lipase blocker. It reduces the emission of the food intake. It has a good tolerability profile, but we need to be careful about the disruptions of vitamin emissions in these patients, so we may give supplementary vitamins to these patients. Norepinephrine reuptake inhibitors, reboxetine, we have data regarding reboxetine. We know that it has a high efficacy, but of course, when we use these medications, we need to be vigilant about blood pressure. Topiramat, it's an anti-epileptic agent, and we use this for mood disorder, bipolar patients as well. It doesn't cause weight it was thought that it could also be used for schizophrenia patients, and it also has a good tolerability profile. Amantadine, this is used in many diseases. It's an antiviral agent, and it inhibits the reuptake of dopamine, norepinephrine, and serotonin. And of course, there are exacerbation concerns, and certain studies were conducted, and it was observed that it can also result in psychotic episodes. That's in some patients. That's why we need to be careful about this as well. H2 receptor antagonists, famotidine and nizatidine, maybe Mr. Atmacı will have things to say about this, because he has conducted certain studies about these two agents, and these can also prevent weight gain in schizophrenia patients. Naltrexone suppresses appetite, and also it can be used for these patients. Of course, there are other drugs in addition to these classic legacy medications. There are phase studies for these new agents that work on these mechanisms, and in the future they will be launched, and maybe they will be available for some of our patients, and different combinations may be efficacious for certain types of patients. So in summary, in schizophrenia patients, antipsychotic use might be problematic in terms of weight gain, but there is no known mechanism. There are many mechanisms that come into play, and that overlap. As GATA and O2, we are focusing on animal trials, and now Mehmet Ak and Tülin they're going to talk about these studies. Thank you for your attention.